Hi everybody, I'm Dr. Joanne from Aglow Clinic. Today I'd like to talk to you about something very special, which is Profilo. I'm sure you guys have heard in the market, aesthetic world right now, Profilo is something that's very in and is extremely famous and popular right now amongst anyone that's looking for something with very low downtime but extremely effective. So first and foremost, you need to know about Profilo is that you need to check its authenticity. So how do you do that? Can you pass me a Profilo box? Okay, thank you. So this is our Profilo box. What you need to do is use your smartphone and then you can see there's a QR code right here, and then you can scan the QR code on your phone, then you can check the authenticity. So Profilo is only available in licensed clinic with licensed doctors because it's by New Asia. They're not going to sell it outside. You're not going to find any other products outside like that. If you do find them outside, means it's not authentic and you shouldn't allow anyone to inject those kind of products into your face. Okay, there you go. So now right after next authenticity, so what do we want to know about Profilo? Do you guys know what actually is Profilo? So it's actually an Italian product produced in 2015. Back then in Italy, it was launched there, and this product has been brought into Singapore in 2019. So up to date, from 2019, from the day it was produced until today, 2019, back then, it has been used more than 1 million times all over the world in 56 countries worldwide. So that is actually something that is not an easy feat, and it's actually really, really good. So when did Profilo come into Malaysia? Can you guys guess? Actually, it came in Malaysia last year in 2020, around mid-June, somewhere there, due to MCO. Previously, they wanted it to come in slightly earlier, which is in March. Okay, so right now it's already in Malaysia. So Malaysians, you don't have to fly all the way to Singapore to actually get your Profilo. Isn't that great news? Okay, so Profilo, 3 main things about Profilo. One is it gives you a firming effect. It actually does tissue thickening, and also what else? Skin tightening. And what does it do? What's so special about Profilo is that it can sort of freeze aging. That's what's so special. In Mandarin, they call it 逆时针. So it actually kind of like in a way stop time. So this is what is so special about Profilo. So some people will ask, Doctor, Profilo is made of what? So what is Profilo? What's the content of Profilo? Profilo is actually HA. What's HA? Hyaluronic acid. So what's so special about Profilo as compared to other HA outside? Do you know the difference? Profilo has 2 kinds of molecules inside. One is a high molecular weight HA, one is a low molecular weight HA. So like, how does these 2 HA combine with each other? So usually for cross-link product, they will use BDDA to actually bind it together. It's a chemical. But Profilo is so special because it doesn't add this kind of thing into this product. So how do they come up with this technology? It's a patented technology. They use heat to bind these 2 molecular chains together. And it's so special that it can actually penetrate your skin and has high spreadability around your skin. So which is why they say it's a very, very pure HA. It's 100% pure HA because they don't add anything else inside. Which is why Profilo is much, much better as compared to other HA. Okay? So what else about Profilo that you want to know? Can you guys guess? Okay, so Profilo is so special that it has high spreadability. And what do you mean by high spreadability? So for example, let's say we talk about something that gives us collagen formation or elastin stimulation. Let's just say the closest and the most common thing that we do is actually PRP, for example, right? So PRP, how do people put PRP into your face? We go by microneedling or injection or things like that. And injection of PRP actually requires multiple so-called injection sites. But Profilo is special because it only has 5 injection points on each side of face. So what is that? It's actually BAP. So what is BAP, guys? BAP is actually the bioaesthetic points. So it's actually created from this company. It's a very special injection technique to actually help you help the product spread around your skin. It's a very strategic 5 points only. It gives clients and patients comfort, and it also helps the doctors or the practitioner to actually ease their working job in a way. So it gives the client comfort and also doctor in terms of comfort when it comes to injecting this product. So the 5 points, we call it BAP points, bioaesthetic points. I'm pretty sure you guys have heard this if you have done some research about Profilo. So another thing about Profilo is that, like I said, it has extremely high concentration of HA. It's higher than any other concentration out there. So how high is high? So in 1 ml of Profilo, about 2 ml of Profilo, you have 64 milligram of the HA content in that syringe itself. That one syringe of Profilo has 2 ml, and in 2 ml you have 64 mg of Profilo inside of HA. I don't think you can find anything else with this kind of such high concentration of HA inside. But high concentration it comes with high spreadability. So what kind of things do you get? You get magic when it comes to your face. Okay, so this is what is so great about Profilo. And it has minimal downtime, it has minimal pain, and it has amazing results. So why not Profilo, right? Of course I would choose Profilo any day over anything else, any skin boosters. And on top of that, it lasts much longer. How much longer compared to other skin boosters? I would say, according to the company, it's 8 times more. It increases 20% of skin elasticity and also hydration, and is 12 times more concentrated and 8 times longer lasting than other HA. So this is what Profilo is. So generally, typically, what happens during a treatment, the doctor will actually use a pen to draw on your face the marking points. Later, I'll show you guys a live demonstration of how I do this with a close-up session so that you guys can actually see how it is done. Okay, so each Profilo injection point, the BAP point that I've explained to you guys just now, is that I told you, right, it's actually 2 ml. So each injection point is actually 0.2 cc of the Profilo volume inside in each point. So 1, 2, 3, 4, 5, so that's 1 ml on each face. 1 ml, 1 ml, so that's 2 ml of Profilo, which is 1 syringe of Profilo. Okay, if you guys have any more questions regarding this, you can actually write into our comment section. Don't forget to share, hashtag and like our Facebook page so that you guys might have something to win. We always encourage people to watch, to learn with us. That's why we have Aglow classroom on a weekly basis, if not monthly basis, so that you guys can learn something new along with us. Our learning process is actually like a continuous thing, 学到老, you know, this kind of thing. So I hope you guys learned something from my talk today, and right after this I will show you guys how it is done. Okay? Okay, so like I said just now, I'll show you guys a live session. So how do I do it? First of all, I use a pen, white color, whatever color, it doesn't really matter, and then I will draw on the patient's face. So how do I draw these 5 points? Okay, first point is at your tragus. Where is your tragus? Right in front of your ears, so which is here. It's 1 cm anterior to your tragus, so it will be point number 1. Okay, that's 1 point. Point number 2. So like in Asians, right guys, Asians, we have this thing called our mala mole. So like that's how we differ with Caucasians. So in Asians, we want to try to avoid the mala mole, so we will adjust accordingly with face shape. Of course, not all Asians has obvious mala mole. For her case, it's not too bad. So I will just inject here. This will be the second point. And another one is through your mid-pupillary line. So what is that? Can you look right in front, in the center, yeah? Okay. And the lateral of the nose. So this is the second point. So I have 1, 2, 3 points. So where's the next point? So over at your center point of your chin, downwards. Okay, at the angle of your mouth, downwards, and then you draw an X. Okay, so this is the 4th point. So the last point, it's at your jaw. Okay, at your jawline. Can you open your mouth very slightly? Close it back. Okay. So at your angle of your jaw, 1 cm towards the nose. So this is the 5 points of your Profilo, okay? So of course it will be the same for the other side of your face. So okay. So I'm preparing the injection Profilo right now. We'll usually push it up to the bezel that you can see a little bit of product coming out. So I'm going to start injecting, but before that, we always want our clients to feel comfortable. So on top of that, we actually always try to put numb cream, number one. She already has numb cream just now. We already wiped it off. Second of all, we'll actually put ice pack so that for our client's comfort. Okay, Wayne, can you put ice pack on her? My first point of injection will be at her tragus, which is right in front of her ears. So, about Profilo, right? So, like I said just now, every injection point will be 0.2 cc. It will create a little blab on top of the skin. The blab, you don't have to worry because it will spread off within 24 up to 72 hours. So the downtime is extremely minimal. It's almost painless for this procedure. And on top of ice, you barely can feel anything. Of course, it's only 5 points, so you don't have to worry about the downtime. Then another thing about Profilo that you need to know that people will be like, oh doctor, I've just injected fillers, I've just injected BTA, botulinum toxin, or more widely known as Botox. So the special thing about Profilo is that you can actually use it in synergism with all these things, such as your laser treatment, your fillers, your BTA. Any one of these treatment is like an adjunct to it. It helps with boosting your skin and hydration. Okay, so I'm going to inject the first point. Okay, relax, huh? Okay, her first point of injection is done. So the second point of injection, I will do it at her cheeks, okay? So that's the second point of injection. Then can you ice her a little bit? Yeah. Okay, the injection about here at the jawline is that it helps with spreadability. Why? Because as you talk, right, your jaw will move. When it moves, it helps spread out even faster, which is a very, very good thing. Okay? Okay, that's her second point. How do you feel? Any pain?
Not really.
Okay. Okay, now we'll do her cheeks. Okay, if you guys can't hear her, she said it's not painful because of the ice. It has a numbing effect. So you don't have to worry about that, okay? Okay, so the next point will be at her chin over here. As you guys can see, there hardly is any blood because it's only 5 points. And you can actually see a little bit of the blood, okay? Okay. Now we have reached our last and final point, which is here, the mid-pupillary line, and also lateral to the nose. Okay? So this is our last and final point of this side of your face. What's so special about Profilo is that this procedure can be actually done in less than 10 minutes. So you can come in for a lunch break or something like that, then you can go back with something that has been magical in your face. Okay? Okay, and now we are done with Profilo injection. So this is all for actually how we do Profilo. Of course, it's both sides of face, one side, one side. Okay, another thing about Profilo is that, Joanne, can you hold this? Another thing about Profilo is that it's not just for your face rejuvenation. Where else can you do Profilo? Which is on your neck, on your hands, inner parts of your hands. Some mummies actually do it on their abdomen with like some wrinkling post delivery. Some people have some very fine wrinkles around the elbow and also the knees. You can do that as well. So Profilo is actually something that's very versatile. It's very versatile, like I said, and you can actually inject in many different parts of your body and your face. Because it's HA, has high spreadability, extremely biocompatible with your body, and it gives very good hydration. Okay? Okay guys, so that's all for today's Profilo. I would like to tell you that again, Profilo is something that is very fast, very effective, very minimal downtime, almost completely painless, and it gives amazing results. It can be done in less than 10 minutes. So other than that, if you guys have any more questions, you can actually put it in the comment section. What I want to remind you guys is don't forget to like, share, and hashtag Aglow Clinic. And another special thing I want to tell you guys about is that in the coming months, we're going to have 2 extra new outlets that's coming out. I want you guys to go ahead and actually join our competition so that you can win something special. Out of the 4 outlets that we have listed, just choose 2 out of it, and then I hope you are the lucky winner. See you guys next time!